meeting at this time. Individual delegation who wish to address the commissioner, Madam Clerk.
Mr. Dennis Troy has something.
Mr. Troy.
Next President, I believe, come with me. Mr. Ray Preach.
Yes, sir.
Chairman. On behalf of the trustees of Bladen Community College, the president, Dr. Amanda Lee, faculty, staff, and students, we come in today just to thank the commissioners, the one that's looking at me right now, all of you, for the support that y'all have given Bladen Community College. Normally we come crying, begging for money, but tonight we come just to say thank you.
More than
Well,
well.
awesome.
How can you top that? Truly, thank you. We couldn't do what we're doing without you, so thank you.
We appreciate you coming, and we're honored to be able to do it for the citizens of this county. And it being on your board of trustees, it's an honor and a pleasure for me to sit there and represent these commissioners. And I see and hear what you do. And I think it's important for everybody to know, the citizens to know, that a lot of community colleges have a downward. Our college, we're honored to know we have an upward swing. And that contributes to the folks that you employ, the staff, and we know that, we appreciate that. We know that starts with administration, and we thank y'all so much.
Thank you.
You're quite well.
Thank you.
Thank y'all.
Commissioners make students successful.
Yes, sir. Anybody else, Madam Clerk? Matter of interest to commissioners?
Mr. Chairman, I'd like to say one thing.
Yes, sir.
I'd like to say, since thank yous are going around, I'd like to say thank you to all that participated in the 32nd Annual MLK Parade. We had commissioners there as well as members from the public, Bladen Community College. Also had Mr. Myers there. He was the driver for the Grand Marshal. I want to say thank you to all that participated in the parade, and we're looking forward to it again next year. So thank you.
One thing.
Yes, sir.
I'm trying to figure out how to address this, Mr. Chair, I read the article in the paper about someone plans on coming to this commission with some type of sovereignty state and all this type of thing, sovereignty county. And I was just wanting to know, would it be advisable for us to be aware of what's getting ready to happen? Because I don't have the slightest idea what he's talking about and why we should be involved with it. Should we have something before he come and present to us, or should we? I'm not aware of it. I don't know whether it be some legal counsel on it or what. I'm just trying to figure out why is he coming?
What are you speaking about?
This thing that was in there about some gentleman coming
Some
in.
resolution, second amendment.
Sometimes want us to do a resolution. I'm trying to figure out, you bringing this in here, and I looked at all this legal stuff that was proposed in the paper. And I'm trying to figure out, do we need to review and be familiar with what he's getting ready to even come in here with, whoever this person is, before they come here with? I'm just asking the question.
That's a good question.
Well, to me, it took a lawyer to read this stuff and I don't know where he's at, but.
Well, I think at this time, it's a presentation, somebody's coming, I think want to speak and bring it to the commissioner's attention, is that not right, Mark?
That's my understanding. I haven't had any direct
You know,
conversation.
he's talking about a resolution, that's what I'm saying, he's talking about a resolution.
Let's hear what Ms. Mark
I
has.
do know that other counties in North Carolina have adopted resolutions with similar type language. And the ones that I know that we've seen, I think they've been on the listserv or whatever, reference the United States Constitution and the North Carolina Constitution to try to do things that are in accordance with the framework of the Constitution. But we can talk with the School of Government and just kind of get a sense. So however the board would like to direct us to look into it, we'll be glad to.
We'll recognize Mr. Peterson.
So I've called Tony Priest, that's who he is. He's got, there's a 3 or 4 page thing out there. I've seen some of the other counties, what they adopted, and for him to look over and make sure it's okay, and then once he says it's okay, then I was gonna share it with the commission, but I don't have nothing to share till he looks it over. It's the middle of February, I think, when it's coming.
Yes, that's what I'm
It'll be
saying.
all the time.
That's what I'm saying, will we be able to be privy with the attorney or whoever to bring this information to? If you got all these counties talking about it, I want to see what they've done. I just want some research on it before it comes to me.
Yeah,
With any type of
they can
proposal.
share that with you.
So I can know what we're getting ready to deal with. That's my concern.
So attached to
I haven't heard anything about people taking guns and violating Second Amendment rights. I'm just trying to figure out where's the county got involved with that. I'm just trying to figure out why we'd be involved with it.
It's attached to the agenda, Marie said, so there's information on your, that the last thing on the agenda, like she said.
And we can send it by email again.
I understand that, but I just like, we got legal counsel here. I like for us to have some legal expertise for this when it comes down. So I know when you're dealing with something that matters, you talking about legal stuff.
Anyone else? Emergency Medical Services, Mr. David Howell, Director.
Good afternoon. Mr. Chairman, I just come to you to ask about declaring 9 manual MRX crew striker stretchers as surplus so we can put them out for disposal on closed bid. These things have been sitting in bay for a couple of months now, and they're not doing us any good. They're outdated, they're past their service life. We want to go ahead and dispose of them, that way we can return some type of revenue back into the county.
I make a motion that.
Got a motion by
I second.
Mr. Bullock. We got a second by Mr. Cogdell. Any discussion? All in favor say aye.
Aye.
Opposed? So moved. Thank you so much, guys. Department of Social Services, Vicki Smith, Director.
Good evening, Chair and Board. We are here to present our December adult Medicaid audits. And I will ask Ms. Lisa Nance if she will review those with you.
And the first chart that we're going to have before us is the application eligibility. And you see those four, does anyone have questions about those?
The first four.
These are our individuals that have more than 1 year experience, so there will be 5 of those.
Thank you, David.
First page, Mike.
I got that myself.
And this is our recertification eligibility for our October, November, December timeframe. And again, this is your employees that are more than 1 year of experience.
I like those numbers. Third page.
And we're looking at our technical applications for October, November, December.
So, obviously, what happened with, yeah, our employee B. Because not everyone, not all employees dropped on that one, but they dropped significantly. Is there a
Yes.
reason? Is that pretty normal for this employee, or is this just an off day?
I'll say an off day.
Off day.
I don't think it's customary for her.
But then 2 of them accomplished the goal during that entire process, right?
And during the month of December, I will share with you that the employees for this particular unit are having additional work that is created through the Social Security Administration, the COLA changes that come for our Social Security clients. So there are some additional work for them to do. And I always try to stress to them and to myself that we do have several young staff, and that creates more work for those that are seasoned to do.
First I'm asking, you saying that staff, and during that time, is there a need for additional staff? Can they meet the demand? I'm asking, enough staff to handle that input at that time?
There are, when they are seasoned and they are fully developed, and know the work, so that they can move at a smoother, faster pace.
So the workload doesn't reflect credit problem?
I'm not gonna say it has here, other than the additional work that they have received through the month of December from the COLA change.
Is, question, you got 5 employees here, is, like employee A, is employee A the same person on each sheet?
Where employee is the same employee,
More than 1 year.
more than 1 year experience, and the same
Correct.
employee left for the year.
Right.
That
Yeah,
come
yeah.
later.
Go ahead.
So we're on our recertification technical for October, November, and December.
The reason I was asking that question again, I see both of those guys were somewhat struggling during that time frame. That's the reason I was asking. The other three seems to be producing as scheduled. Is there a demand on all of them the same, or this, on those particular ones?
Basically, the demand is, usually uniform to all of them.
Well, on the technical side, she done, employee B did pretty good there for 2 months, and she dropped last month. So, I mean, she could just screwed up and made an error, a big error or something, or left something off or something, yeah. Technical audit, she's not made a whole, employee B has not made a whole lot of progress.
I'm just looking at the two of them. This like it's been kind of consistent with the two of them that was having some different, so that's what I'm saying. The workload shifted something. So then we'll just look at, see if we can bring them back into compliance on the next time you come to it.
Correct.
Okay.
Mr. Chairman, I just have a question.
Go ahead, Mr. Gordon.
How many employees? I know we have stats here on 5. How many employees do you have in the department? I mean, that goes under this category? I'm sure it's more than 5.
There's 6 positions in that one area.
Correct.
The 6 are your, adult Medicaid, and then we have the 3 that are for the long-term care, like nursing home placement.
So you got 9 employees involved in this? I thought you had more than that.
But you finding this accountability is helping, correct?
Yes, sir. Each month when we're, reviewing their work and we have issues, we bring them in, coach them, and we are monitoring the trends as well.
Have you looked at the table from January to July, or 6 months for three? Because you'll notice that, last month, a lot of them were doing well. Now, this month, this quarter, so it was less. So have you looked at the trend for the whole year to see?
We do have a chart for our viewing that does that, where we can see that at a broader picture.
And so, looking at that, what do you think is happening?
Well, it's the holidays and less days worked, and,
That's December and, maybe.
November is a holiday month.
But early last month, it was the same thing, they had some going down. So because they were new, is that why?
And-
The low, couple
and-
years, couple months ago.
Right, and to remember with, the Medicaids or in income maintenance, it is not a program that is learned, overnight. Even at a year, you're still learning, and even after that year.
So next year, we should see, this year, we should see most of them above, at least at the norm. Thank you.
We was talking about the cost factors,
And there's
so.
been a lot of changes in that as well.
There has
Been
been.
a lot of changes.
Yes, some of them.
When we was talking about getting into a cost factor with
3 months ago.
reimbursements,
Right.
with a 90-day period or 2 90 days, what period, time frame would it be before you get into some type of a cost factor? A repayment factor, does it have to be correctly
That
within?
would come at the end of the year with, the single county audits.
So this wouldn't be a part of that.
No,
So once you get to that final audit, is when it reflects whether everything is in compliance. This is to
Correct.
try to make sure that there.
correct.
So 90 days won't make a difference, but it's 180 days. Okay.
At the end of the year, when we have that one,
Well,
Annual audit.
if your data's low, it's gonna have an impact on you.
That's what I'm trying to figure out. When we,
Yeah, if the data's, employee ABC's not doing their job and they got low numbers, yeah, it's going, at the end of the year, it's got to reflect it.
that's what I'm thinking.
Yeah.
When do you need to turn it around?
It will reflect because of the cases that they will randomly audit. They may not randomly audit the same cases that we do, so at this point, we won't know until
So
we.
the cost factor, you can't really justify it in reason for it now.
Go ahead.
Okay. Next, we look at our Medicaid application eligibility for our employees with less than 1 year, October, November, and December. And then this is less than 1 year. And the certification eligibility. Our application technical audit for the same 3 months. And the certification technical.
So, employee A's going, the employee A tonight's gonna be the same employee next month.
Yes.
So,
Any other questions?
What other departments, you know, this is just Medicaid, I mean, this might be a stupid question, do we do food stamps like this too?
Their cases are audited, but we're not presenting.
So you got Medicaid, you got food stamps, and what other programs you got in?
We have workers,
Okay.
childcare programs,
So,
all of them complete second party reviews.
so they're not included in no report like this?
They don't have a report like this.
Could I make one observation to see if, is it, I'm looking at, it was a concern with the downward trend in the technical audit, and more than 1 year and less than 1 year. Both of those groups had some complications in that particular phase of it. Is that one that need to be more time devoted to, or how do you fix that one? Because like they're having a problem here with lower scores in that Medicaid application technical audit. The ones with less than a year, the ones with more than a year. That seemed to be the third with the most concern. Is that an accurate statement?
Not really.
Just from looking at the graphics you have here.
But the more than 1 year, just, every one of them went up this month. In technical, well, mild.
remember, your technical does not have anything to do with the eligibility, which would be your cost factor.
The only reason I'm just looking at the lower scored months, with both of them during that time, but more than one less than a year for technical audit and recertification and technical stuff. No problem, I'm just looking at this, the trend with both of them trending, that's all.
Thank you, ladies. Appreciate what you do. Health and Human Service Agency, Dr. Terry Duncan, Director.
Good evening, it's so good to be here with you guys tonight. One of the things that I learned a year ago, when I first started, was to try to learn the programs, but more importantly, to try to learn the staff and to help identify barriers and remove those barriers and let the staff do their job. So tonight I present to you Betty Bryan. She's a registered nurse. She's been with us now 9 months and has began to own the communicable disease program. She and I are gonna review, primarily Betty tonight's gonna review the communicable disease report. And I wanna say too, that since Betty's been with us, she has, gone back to school and is now pursuing her bachelor's degree in nursing, and is also enrolled in the state program for an enhanced role nurse position at the health department, one that's sorely needed. So I present to you, Betty Brown.
Thank you.
Welcome.
Thank you. Good evening.
Good evening.
So I'll be presenting the communicable disease report for 2019. Am I talking loud enough?
Yes, ma'am.
Let me see if I can work this. Okay. So if you look at the slide with, this is from the CDC. This is basically what they send out. They send out weekly notices updating us with reports. So this one is from 10/1 to 12/21. What I would like you to notice is, as far as the preliminary flu burden, is that there have already been, this flu season for 2019-2020, 2,100 deaths. The next slide is for the last two seasons and this current season. If you'll notice, the red is for this current season, and it peaks on the week of 12/28. Well, normally the flu season peaks from in December and in February. So if you look at the previous seasons, you'll see where it has peaked in February. So this is just something that we monitor weekly. There's also been the wording of that, I should have worded it different, but basically, as of 10/28, from the flu season, there's been 10 total deaths, but none have been reported in Bladen County. And the hospitals have issued visitor restrictions, including our own Bladen County Hospital. Some of the restrictions, I'm sure a lot of people are aware during this time, they have signs up saying if you have children 12 and under, please, do not visit, do not come up to the patient units. And in the emergency department, it's one visitor per patient. The measles outbreak, we were notified earlier last year of a measles outbreak connected to New York. And so in 2019, there's been over 1,200 confirmed in 31 states, and 75% of those were linked to New York. And the majority were not vaccinated. But there again, there was no confirmed cases in North Carolina. The STD for 2018 and 2019 data, I'm not sure if you're aware, not to insult you, but the finalized data, that's where the state has confirmed that they did meet criteria for the diseases. So 2019, the preliminary numbers for last year may change the next time you receive a report. If you notice, the numbers for chlamydia and gonorrhea are exceptionally increased. But then if you look at this chart where we're comparing ourselves to Columbus, Robinson, and Sampson, you'll see that we're still typical. We're not, actually our numbers look better, but these were the closest counties that met our demographic population that we could compare to. Communicable disease, which this is mainly my area. 2018, the finalized numbers, you notice that they're focusing on hepatitis, the different stages of hepatitis, salmonella. And then in 2019, as far as hepatitis, some of the numbers look small, just like with TB, we have one case, active case. But still, the numbers may be small, but there's a lot of work that goes into monitoring these diseases, follow-up, contact investigations that you have to go through. This active case I'm currently managing, and this person is being managed per TB policy, and is not currently considered a threat to our citizens. We made another comparison to Columbus, Robinson, and Sampson, and there again, if you look, our numbers still are in line with what they do or better, in my opinion. And that is all. Mine is short and brief, but do you have any questions for me?
I got one. When you look at these communicable diseases, and I'm looking at the number of cases that you're showing here, how do you monitor that number, is it by them coming into your office? Is it by doctor's reports? How you monitor to say it's just only one?
We have a state, website called NC Eds that I have access to, and the doctor's office and the clinics. And what they do when certain lab work, and also the labs, certain labs will just go ahead, if they've drawn a hepatitis B, they automatically, download it, or upload it, excuse me, to that website. So therefore, in my county, I can look and see every day. I check several times a day. I'm constantly checking to see what has been put in my workflow that I need to follow up with.
And we have physicians' offices, any physician's office, clinic, hospital setting that orders a test is responsible for the follow-up. So if they had a positive result, they would contact the health department. And in addition, we see those labs about the same time they do, so if they haven't contacted us, we would contact them.
What do you all do to notify the public of the services that are available? You know, it's a newspaper or TV or that's available at the health department. I mean, you have handouts, or how do y'all notify the general public of services that are available?
We do have multiple brochures that we are out and about in the community as we speak with different organizations and our different fairs and so forth. We also have a very active now Facebook page. Travis Greer, the health educator, has done an excellent job. You'll see 3 or 4 posts at least every other day. In addition to trying offering the services not only at the health department, with also the Division of Aging and Social Services as well as the agency. We're also promoting, the Sheriff's Department reached out and wanted to do a blood drive. So we helped them, and you'll have seen yesterday that we're having a blood drive, or they're having one at the Sheriff's Department that we help coordinate for them.
All right, thank you.
At TVS, we have that opportunity as well. We also have the, sign at the health department, the flashing lights, and we changed that, just about once a week.
Okay. All right, thank you.
And they attend civic clubs upon request to do programs.
Absolutely. One other thing on communicable disease, I want you to know that we are, on top of what's happening internationally, and there is a coronavirus that's in China, and 4 days ago, they actually have started screening at 3 airports in the United States for people that are coming back from China. There is word that the CDC may be meeting tomorrow and have some additional updates for what we may be looking at international there, because there have been a certain number of deaths. And I don't have the latest data on that, but it is beginning to increase more. So we have also been in contact with the state lab today and trying to work in with our partners. So just know that we're on that, and we will continue to take precautions there.
One last question. I know like with hepatitis B and certain one of those shots that you can go to a doctor and they'll say you need to get your Hep B shot. You need to go get your Hep B this. And some people don't have the insurance to go get it. Is there any support that a person can go to get a Hep B shot? Is it in the agency, or how would they do that? Because they do tell you to go get it, they call us. They're screaming high.
And as we talked about with the flu vaccine, we do have the sliding scale. And if we had someone that did not have the funds, we would certainly look for other options with them and try to help them find those.
So if a person said the doctor told them to go get one, we tell them to come over and see you guys, see, can you possibly work out something?
Yes, sir. We would do what we could.
Okay.
Yes, ma'am.
So our next item is an update regarding the 2020 Red Day recognition. This was in your packet. The American Heart Association sponsors the first Friday of February every year, a National Wear Red Day. I want you to take a moment and look to your left, and then look to your right. If you're female, or if you're male and have a wife, mother, sister, or daughter, 1 of 3 statistically will die from cardiac disease, more than all of the other diseases combined. So the Wear Red Day is to bring awareness for cardiovascular disease. Also in your packet was the signs and symptoms of heart attack and the signs and symptoms of stroke. Research was done on men, and so most of the information that was put out was more related to men than to women. Women sometimes don't experience that crushing sitting on the elephant chest pain as men do. They experience a more epigastric pain, gaseous pain, so it's important that we educate women in our lives of the difference. Jaw pain, shoulder pain. So I encourage you to share with your other civic organizations, and maybe your churches and communities, to everybody wear red, support through awareness of Wear Red Day. And I also have a pin for you that I left on your desk, a Wear Red pin. So if you, someday I'd like to paint the county red on that Friday. That's a dream one day. So the next item is to consider adopting Health and Human Services Advisory Committee operating procedures. This is the manual that we need in order to do business.
Pleasure of the board.
Second.
Got a motion by Ms. Trigger, we got a second
Second.
by Mr. Bullock. Any further discussion?
Can we refer to the one that we already have that manual, do you do any revisions to it?
It's in your packet.
So it's all should be the
Yes, sir.
same.
All in favor say aye.
Aye.
Opposed?
And final item for us is consider approving the memorandum of understanding with Indiana Regional Medical Center for care of our HIV/AIDS patients here in the county. This is a renewal.
Motion to approve.
Second.
Got a motion by Dr. Longoria, we got a second by Mr. Trigger. Any further discussion? All in favor say aye.
Aye.
Opposed? So moved. Thank you all so very much. Finance Officer, Ms. Lisa Cole.
Good evening to each of you. I'd like to review the dashboard for arguably the 6 months of the year. And we'll do 50%. The revenues for the first 6 months of the year have brought in 53.88%. I would like to share with you that this on property taxes, that is a 9% over 18's totals and a 3.7 over last year. So our property tax collection has increased. And our local option sales tax is up 8% overall for the 2 year combined. Our expenditures on general fund are at 47.81%. The solid waste collections and the revenues are at 58.43%, and the expenditures are 49.29%. We are still monitoring that on the solid waste fee, and we've talked about that before. The tonnage is down, however, the cost to operations is still exceeding. So we're still monitoring that pretty close, and we'll discuss that at the February 12th meeting. Emergency telephone is at 41.98%, and net expenditures are at 34.52%, and the water has collected 50.69% and spent 29.04%. Any questions on the dashboard?
Just got one question. I just got a question, I don't really just need some explanation. Under the revenues miscellaneous, you got a negative 39%?
Yeah, that's from the, amounts for FEMA that we haven't collected
Oh,
yet.
okay.
It shows in there as a receivable, and it's still sitting there as a negative in this year, and I'm still praying we get that.
Okay,
covered.
all right, thank you. I saw
I'm
that
fine with
negative, that's
it
it.
every time I see her, I said, okay, get that covered.
Ms. Cole.
I know you were here when we had the program that was introduced by the sheriff. Will your budget update reflect any of that cost that we can see on there? Will it be projected in there? Will it
Yes,
be
sir.
line item where we can see it?
Yes, sir.
How would it be listed?
I've got a separate line item to show the revenues coming in and the expenditures are all incorporated into the, staffing, into the equipment purchases. But I have a separate line item to show the revenues that we're actually receiving in for, you're talking about for the federal inmates?
Yeah.
I've got one for that, and then I've got the revenues reimbursement for the detention officers and the mileage reimbursement.
So I'll just look at that on the in your
It'll be in the detailed budget.
detail, but you would.
And I've actually got a slide on, me and Greg talked about that earlier, and I've got a slide set up for the February 12th to show you in it.
Okay, because I know you be updating us all the time with those things, where you gonna have it, where we have a constant flow of what's
Right.
going on there.
Matter of fact, we've already received our first payment, so,
Okay.
Thank you.
all right. Thank you.
Update regarding 2020 census, Mr. Greg Elton, Planning Director.
Probably heavy hitters with me tonight. I have Demario Thomas. He's our regional partnership specialist with the U.S. Census Bureau, and Jan Maynard with the Lumber River Cause, who's been helping us at our local meetings that we've been having with our complete count committee. So I guess we could start this off with Demario kind of giving the overview of.
Good evening, my name is Demario Thomas. I'm the partnership specialist with the U.S. Census Bureau. I am kind of the Paul Revere of the census. The census is coming. Well, actually, it's here. Today is the first day of enumeration. You all may have heard something in the news about remote Alaska. Our director is out there now on a snowmobile and dog sleds and stuff, and they're getting out there to those remote parts of Alaska. But for us, it's going to start on March 12th. This is going to be the first decennial census that can be completed online. We're going to encourage the public, every single individual counts, and so we're going to encourage the public to complete that census survey online, over the phone, or request a paper survey. Again, we want to count every single individual once, only once, and in the right place. We want to focus on our hard-to-count populations, which are our children, most importantly. They were undercounted in 2010 by over 1 million children. So we want to make sure that we count children 0 to 5. We want to count our elderly individuals, renters, our non-English migrant-speaking population, any individual who has a disability. The census data informs just about every program you can think of. And from a census standpoint, we look at it twofold. Every individual represents money and power. That's $675 billion allocated annually coming back to our states and counties. And then power, we look at the drawing of our election maps. Redistricting is coming up, and so we want to make sure that everybody is counted in this upcoming decennial census. Again, I'm the Paul Revere, and working with Jan and Greg, we want to make sure that we identify those trusted voices in the community, that the voices that people resonate with individuals, that when they say, hey, this is vitally important, you need to get out and do it. Do this because you count, you matter not only to your state, but more importantly to your local county, because each individual represents money coming back to Bladen County. In other areas, I know Brunswick County has just allocated $15,000 in their county budget to promote the census, because they realize the importance of counting everybody, and they estimate they have about 12 individuals moving in a day, and so they definitely want to count those individuals in this upcoming decennial census. And so from a Bureau standpoint, we want to work with your complete count committee, you all, and any entities throughout this county to ensure that every single individual gets counted, because this data informs schools, road construction, medical facilities being built. This data is used in our community development block grants. It informs a myriad of programs that bring resources back to affect your local area. And so we want to, again, make sure that every individual is counted once, only once, and in the right place. And working with Jan and Greg, we're going to ensure that, and I will answer any questions you all may have about this.
What is we've heard 2 or 3 different numbers. Per person, what does the dollar equate to for our county?
From a Bureau standpoint, we don't get down into the weeds. Our overarching message is $675 billion, but if you would go to the NC Counts Coalition or NC Democracy, they have reports on their websites that I think they estimate anywhere from $1,800 to $2,400 coming back, but you will have to verify that information to them.
You mentioned that around 1 million children were not accounted for in the previous census. do you think that skewed the numbers for the adults also, who would probably be the ones?
Without a
Yeah.
doubt, without a doubt. So our goal is to make sure that we educate the public so every single individual knows they count. And that includes individuals who are experiencing homelessness. I know it's kind of taboo in some areas to talk homelessness, but we do have individuals that are experiencing homelessness. And from a census standpoint, our definition is completely different than, say, a HUD definition where you do your point in time count. I'm not sure when that count is coming up for your county. But for all intents and purposes from the Census Bureau, we count any individual who deems themselves homeless. If they're doubling up on a couch, if they're sleeping in an RV, if they have to sleep in a garage or some area like that, if they're out in a tent, we count those individuals, and we want to make sure that we identify them so they can be counted because they matter to us as well.
Could you talk about the YouTube, Count Me In, and also the coloring book and so forth?
Yes, sir. Well, there's tons of productions out there, so I don't want to speak to any single YouTube video, but the Bureau has produced countless YouTube videos as well as other marketing material to reach those hard-to-count populations. And specifically here in North Carolina, our team is taking it upon ourselves because everybody on our team is invested. I know I am. I said Atlanta, but I'm local. I worked in the Sand Hills and Cape Fear region pretty much my adult career, and so I'm familiar with the needs and the issues in the Sand Hills and Cape Fear region. So we have specifically designed a coloring book that we're trying to get out to every single fourth grader and below in the state. And again, we've had some counties to commit to funding this initiative. And in other areas, we're looking for alternative resources. Of course, you know, the state doesn't have a budget. Even though the state has a complete count commission, they have not been given a budget. So they're kind of playing with their hands behind their back. So we're looking at the local counties to understand the long-term impact this is going to have on their immediate area and to look at ways of providing some type of resources, be it in kind or otherwise.
So really, it behooves us to go ahead and include some funds in regards to the census as far as getting people informed of what's going on with the census.
I would strongly echo that sentiment, and given surrounding counties are definitely understanding and moving forward with putting some money up and having some real skin in the game and letting their citizens know that, hey, we have a vested interest in ensuring that you all count, again, because you represent money and power for our local area. And the more we can stress money coming back to the local area and how it's going to impact the roads being built, the new housing facilities, rehabilitation programs, our community development block grants. Just think, all of us have gone through 2 hurricanes in some sort, and we have displaced individuals and whatnot. If we don't ever count those individuals, that money won't come back to our local area. And so that's just a wasted shot that we have to make sure that we have as much money coming back and as much political influence as possible. In 2010, South Carolina, as a state, put $1 million into their state budget, and as a result, they received 1 congressional seat. Here in North Carolina, again, the governor has formed that complete count commission, and they've done some research, and they have determined that 82% is the ideal goal for the state, and that's just to ensure 1 congressional House seat, which will put us at 14 for the state. And in some areas, they've even identified potentially 2. However, there's still no budget, so we're looking at the local levels, and of course, your metropolitan areas, they've hired media companies and things like that to push forth their message. I know a county like Mecklenburg, we couldn't compare it to Bladen, but they have a budget of $400,000, a private advertising firm, so on and so forth. Yes, sir.
So why didn't y'all lobby the legislators up there even though they didn't have a budget?
Unfortunately, I don't have the ability to lobby anyone. I'm a nonpartisan servant of you all, so I'm here to make sure.
If you wait on the state budget to fund it, I mean, as long as the county people like that can fund it a whole lot easier, we can. I mean, if we would have heard this message, that there weren't no money, then maybe we could have lobbied for you, for us. That's okay.
Yeah, unfortunately, that's way above my pay grade. I'm just here to be the power reviewer, to get the message out. Yeah, it's here, it's here. Like I say, today started, this is the kickoff. And again, March 12th, our website should go live. this didn't come from me, but our goal is to crash that website. We want as many people as possible to flood. We want that problem of the website crashing because we know then that we have an engaged public, but hopefully we won't get to that point. But if we could encourage every single individual to complete that census survey either online or over the phone or call in and request that mail-in survey, because every time we knock on a citizen's door, that costs us as taxpayers anywhere between $60 and $75. So that internet and the phone is a cost-saving mechanism as well.
Thank you, sir.
Thank you all so much.
Thank you.
Thank you.
Demario, he spoke on a broad level about the 20 census. So what Jen and I are going to do is kind of break it down and kind of tell you what our local, you heard it mentioned, the complete count committee. That was one of the first things that we did when we were started working on the census. And the complete count committee is a diverse group of people through the county from various facets of the county, from anywhere from housing. We have education representatives, faith-based organizations, the business community, the health community, special population groups, homeless population, government, community-based organizations, civic organizations, the media, and publicity. And we've been meeting, I think, since August. We meet monthly, and each committee has been, tasked with coming up, with ways. Basically, our job is to get the word out to the people. And in the housing communities, the Stevie Craig, with the apartments and the housing authority, they're actually planning some gatherings for the housing authority to kind of help, trying to get the hard to reach populations. So that's what we're trying to target. The churches, Jason Williams with Foundation Church, he's on our committee. There's probably 20 or 25 people that have been appointed to the committee. But we do have some challenges. Getting with the way the census is going to be done this time, with people with PO boxes, not getting a notice, and so a lot of it's going to be done, like you were saying, knocking on the door, and
So the packets are not going to be sent out to the
You
individuals?
will not to PO boxes.
Right.
But they're encouraged them to go online and show their residential address.
you'll get like a postcard in the mail with a barcode. Is that correct?
Not to PO
No,
boxes.
not the PO box, just mailed to
Little carrier.
your.
You'll get an invitation to participate in the census, and you can go online. You'll have a barcode that will identify your home. Or if you've just got your physical address and you don't have that barcode, you can go online and complete it. So that's one of the problems that we're having in Bladen County, is because internet service is not readily available, and a lot of our citizens don't have computers. You've got some census block groups that have 50% of the population doesn't have internet. So the effort, before you got something mailed to your house automatically, now you have to make the effort to go forward and want to participate in it. So we've been, Greg, with the Complete Count Committee, has been trying to do education the last few months. Now we're moving into a mode where it's participation. But last time, in 2010, when we worked with the census here, our churches were our biggest advocates, because people that don't trust the government don't want to fill out their census form. People that rent homes aren't usually worried about where money's coming from into the county. And those are very general statements, so take them for that. I mean to be negative. But those are the folks that don't usually participate, and now we've made it hard for them to participate. We don't usually get a lot of participation from our migrant population. We have a very racially diverse population, and sometimes minorities aren't quick to participate in the count. So we need to get the message out that it's confidential. There are very few questions on the census form this time.
I think there's like 9 questions. It's 16 pages long, but that's because they give you room to include at least 7 to 8 people in your home. But the questions are very basic with, of course, if you own or rent your home, your racial status, your ethnicity, and that's really it. I mean, it's very non-invasive questions. So we need to let people know that. We need to get that word out.
Mr. Peters, what's the difference in a post office box and a 911 address?
They have
Who
used,
has a post office, I thought we went strictly 911 addresses.
Yeah, some people don't get their mail at the post office. Everybody's got a 911 address, but they
Don't get the
get their mail at the post office.
you've got close to
Well,
60.
post office box to me, I used to have post office box 26, that meant before 911, that's the reason I was asking what you said. You're talking about a box at the mail.
Physical, yeah, mailbox.
At,
If you get your mail at P.O. Box,
post office.
you're not gonna get anything from the Census
Well, that's why I
Bureau.
was confused, because post office used to be your mailbox in front of your house before 911, that's where I was confused.
Oh, okay, no,
So you're talking about a box at the
post office.
post office?
Well, the first matter of concern is when you're saying that P.O. boxes, you're going to be eliminating that. But when you have registered voters, like the voters at the Board of Elections, wouldn't that be a source? Because they all have to give a physical address as to where they're at. If they got a P.O. box, it's still you can identify where that person's at.
The way the Census Bureau is addressing these, the Mario still here?
I'm here.
Okay, if I get this wrong, please jump in, okay? The way they're addressing that is they're identifying every housing unit on the ground in Bladen County, and they're tying that housing unit to a 911 address. So they may have used the Board of Elections to help do that. They use the county's GIS system. They use the towns to identify the ones inside corporate limits.
Well, no, is there any way that you can identify who all gets mail at the post office? At P.O. boxes? How you?
We can't get a list of those from the post office. We've contacted the post offices to find out how many people we're talking about. But what we're dependent on is the enumerators that are just being hired by the Census Bureau. They're the ones that are gonna make contact with people that don't voluntarily participate. They're gonna be going out, and they'll go out up to 5 times to make contact with a housing unit.
Three times